Well, hi everybody. Thanks very much for the invitation. And when I was contacted about being part of today, and I saw the headline "Building Bridges, Beating Cancer," I thought, well, that's right up my street. I'm Mike Morrissey. I'm the Chief Executive of the European Cancer Organization, and we're like a federation of oncology organizations, patient organizations across Europe who are all in the business of reducing the burden of cancer and making sure that we improve and save lives. And we try to do that work in a really inclusive way. And working together, we find whether it's a nurse, an oncology pharmacist, a surgeon, whoever it is, a medical oncologist, a patient advocate, a policymaker, a politician, everybody, bringing those people together is where the solutions lie, in our view, in beating cancer. And when I saw the program for this event and saw the startups involved, the universities involved, research centers, patient groups, there's a lot of innovation in those areas. And what we think is that by working together, we can create the right culture, the right atmosphere, the right opportunity to beat cancer and to put the patient first. So often, what happens in these discussions is that the patient may get a voice very quietly at the end somewhere. What we're in the business of, and it's a noble cause, everybody listening to this, everybody working in the European Cancer Organization, it's about beating cancer. And let me give you a little bit of context because I'm spending a lot of my time talking to the European Union, the World Health Organization, national health ministers, MEPs, speaking to a lot of people. And the context is that we've been on about this for years. We've been asking for cancer to be prioritized for years, and it hasn't happened until now. The stars are aligned. We've got the European Commission putting 4 billion euros into beating cancer. And what does that make us feel? But that makes us feel we've got a responsibility. We've been asking, we've been asking, we've been asking. We've been waiting and waiting and waiting. And it's like waiting for a bus. Then you get three in a row. And all of the EU initiatives are coming at us at speed. And there's a real opportunity for us across Europe to use this moment in time to make a massive difference in beating cancer. But the politicians can't do it on their own. National governments can't do it on their own. Health systems won't do it on their own. Oncologists can't do it on their own. It requires a team effort. And the real reason we're doing this is because if you're suffering from cancer in one country or in one part of one city, you don't get the same access to treatment as you might get somewhere else. And we just think that that's wrong. We believe in having equal access to treatment and expertise and help. And that all relies on reducing inequalities across Europe. Some of those inequalities are based on where you live, which country you live in, which city you live in, which side of town you live in. Some are about your age. Are you a child? Are you someone who's elderly? What gender are you? Do men get better treatment than women, or do women get better treatment than men? Your sexual orientation, that can be have an impact on the treatment that you get. What level of education you have? Are you someone who is asking the right questions of your doctor? What's your socio-economic status? Do rich people end up getting better care than poor people? All of this stuff is all about inequalities. And what we want to use, what we want to find is the answers by using innovation, by using data to highlight the issues, to really make sure that in this period where the European Union is investing so much in reducing inequalities in cancer, that we really use this moment to make a difference. And we need your help. We need people working in different areas, in research centers, in universities, in startups, to really come up with the ideas and the innovation that makes the access more equal, the opportunity more fair for citizens and patients all across Europe. And you know, when I was looking at some of the stuff you're working on this week, um, there's many interesting topics. Digital, how can digital tools help the workforce, pharmacists, nurses, doctors, spend more time with the patients and the loved ones of those patients rather than filling in forms or ordering stuff? How do we make sure that patients are safe and are protected through digital tools that make sure that overstretched and tired doctors and nurses and pharmacists don't make mistakes? How can we make sure that the systems are optimized? Because we know that a patient really feels the difference when their healthcare system is right on it, knows what's needed, gets the job done in a short period of time versus operating in second gear. I had a loved one who found out that they had breast cancer just a month ago, and she was very fortunate. She felt the lump, she noticed it, she went to a doctor. Within 3 weeks, she'd been operated on. Amazing. If only everybody had an equal access to that kind of treatment. And the reason why, we all know this, but the reason why it's so important is cancer. With cancer, any delay, every second counts. Every delay means more deaths at the end of the day. And all the work that you're doing to find good new solutions, to get digital solutions, data in the mix, all of this innovation, all of these great ideas are all about making sure we cut the delays, we get the best possible treatment for our patients right across Europe, cutting out the inequalities. And we believe at the European Cancer Organization that we can help too. We've done a couple of initiatives recently you might be interested in. One is on patient empowerment, 10 patient rights that every patient and their loved one should know. They've just heard the bad news, the traumatic news that they've got cancer. What do I do? What do I say? What questions do I ask? If you go to our website, europeancancer.org, you'll find the European Code of Cancer Practice in 30 languages. Questions you should ask, the main points you should be thinking about on this long journey of being a cancer patient. And finally, there's our Time to Act campaign, timetoactcancer.com. That is all about COVID shining a light on the improvements that need to be made in cancer care. Of course, COVID's really created problems for diagnosing cancer, screening cancer, screening getting appointments getting cancelled. We've done a study which showed that 1 million people could have been impacted and have cancer during COVID and not know about it because of their own fear of going to the doctor or because of screening screening opportunities getting cancelled. Time to Act is in 30 languages. This is all about empowering people to ask the right questions, to get involved, to understand that cancer is not something that you can wait on, whether it's because of COVID or because of denial or because your healthcare system isn't as efficient as it should be. Patients lead the way. The questions patients and their loved ones ask lead the way. And all the work that you're doing to find these fast, innovative solutions to making those improvements and addressing inequality in cancer, we want to hear about them. We're looking forward to hearing the outcome of your work. Good luck, and feel free to contact us at europeancancer.org anytime. Thanks for listening. Bye-bye.